of San Diego, the coronavirus does not know nor care your race, your gender, your religion, your sexual orientation, your country of order, or your immigration status. It does not care about any of those factors, and here in San Diego County, neither do we. We are here and ready to assist and aid all San Diegans to get the care and the assistance that they need in this time of crisis. For all of our communities in San Diego to stay safe, our government agencies are working in a coordinated regional effort to deliver accurate information and provide access to everyone. That's why we're standing here today, to ensure that the community is informed, to make sure that all communities know that the services that are out there are available to everyone. To fight the coronavirus and ensure the health and stability of our communities, we must be united, we must support one another, and one another means everyone. Regardless of your status, regardless of your community, regardless of your income level, regardless of your situation in life. Our collective purpose is to protect everyone, and in particular, the most vulnerable community members we have. Immigrants are a part of the fabric of the American society, and they are a part of our outreach strategies, and they are a part of our care network. No one should be afraid of going to the doctor and seeking medical care if they need it. In the state of California, hospitals and other care providers are required to provide care to everyone, regardless of their legal status. So we're here today to encourage members of the immigrant community to get health care resources and to contact government agencies for more information. No one should be afraid from asking for help or seeking. The health of our community is more important than anything, and we urge communities not to be afraid to ask for help for themselves or their family members, for seniors or their children. Call your doctor. Call our access line, 877-724-7420. In addition to the services that are being provided by government, a coalition of partners from philanthropy, government, business, and labor have come together to create the San Diego COVID-19 Community Response Fund. This fund was launched just 72 hours ago with $1.3 million, and I'm pleased to share with you that as we stand now, we have over $4 million that has been received. Both from individuals making $10 and $15 contributions, along with some substantial contributions. Those funds are for food security, rental and utility assistance, and income funding and gap replacement. These funds are available for everyone, regardless of their immigration status. There is no screenings for your status in order to access these much-needed emergency funds. It is really important that we all stand united and we move forward, and we want our immigrant communities to know that the services that are out there are available to them and presented in a way that they should not fear receiving. We have some great leaders who represent these areas and fight every day for these areas that are here with us today, and it's my pleasure first to introduce the President of the San Diego City Council, Council President Georgette Gomez.
Thank you, and thank you, Supervisor Nathan Fletcher, and thank you to the community for being here and coming together. I'm going to start by delivering my message in Spanish, and then I'll transition very quickly and summarize it in English. Gracias a todos por estar aquí. Sé que este momento es muy difícil para todos, pero es importante que compartamos información precisa, especialmente con la comunidad inmigrante y refugiados de nuestra región. Estamos juntos. Cada uno de nosotros puede proteger a la comunidad y a los demás. Gracias a todos los líderes y organizaciones que han abogado por las personas más vulnerables de nuestra comunidad. Este es un asunto de vida o muerte para la comunidad, específicamente nuestra comunidad vulnerable. Es importante que todas hagan lo que puedan para mantenerse seguros. El virus no conoce fronteras, ni estatuas económicas, ni de dónde viene. Este virus no discrimina y nosotros tampoco podemos hacerlo. Las personas que están preocupadas por esto son específicamente comunidades inmigratorias, tienen menores probabilidades de buscar ayuda y tratamiento. Cuando el presidente Trump llamó este virus chino, sabemos lo que está haciendo. Está tratando de dividirnos como lo ha hecho desde el principio. En San Diego estamos unidos y listos para apoyar a nuestra comunidad inmigrante y refugiados. Yo represento el Distrito 9, que está compuesto por la mayoría de los refugiados e inmigrantes en nuestra ciudad. La pandemia de COVID-19 ya está ocasionando daño en nuestra comunidad y a los largos de nuestra economía regional, impactando a familias vulnerables, individuales y negocios. Debemos actuar inmediatamente para proteger a aquellos que están en mayor riesgo de sufrir adversidades financieras. La ciudad de San Diego está finalizando las leyes para asegurar que nadie afectado por la coronavirus sea desalojado de su hogar. Necesitamos asegurarnos de que cada comunidad obtenga la información para mantenernos sanos y salvos. Juntos podemos asegurar de que cada comunidad tenga acceso a la atención médica y a los recursos adecuados en estos tiempos muy críticos. Quiero asegurar a la comunidad migratoria de nuestras comunidades que por favor, si están pasando problemas de salud, que vayan y agarran las pruebas necesarias y van a tener un lugar seguro y no va a haber necesidad de probar si es ciudadano o no. Es muy importante que todos tengamos acceso a salud y queremos asegurarles que estamos aquí para protegerlos y vamos a hacer todo lo posible para que sea eso. Just want to thank everybody for coming together in these critical times that we're facing. As leaders, we're trying to do everything possible to ensure that we're reacting and creating safeguards to ensure our communities that we're creating a safe community for all. But today we're here to elevate the importance that we know for a fact that this virus is hitting us all and is impacting our business community, our residents, our hardworking community members. But more importantly, we know for a fact that the most vulnerable get impacted the most. And specifically communities that are immigrant communities, our refugee community members, and perhaps even those that are undocumented. So we want to ensure and reassure that our community members have access to health care, that if they are facing anything related to the virus, that they please go and get tested. They're not going to be asked of their any documentation, and they will be protected. So we want to urge and stress the importance to please go and get tested. And we are here to ensure that you're not going to be the Border Patrols or your documentation is not going to be asked. So please ensure that you're going out there and getting tested, and make sure that if you need any resources related to job loss, economic loss, that we're also working really hard to ensure that there are safeguards to ensure that you're keeping your home, and more importantly, that we're here to protect you. So thank you so much, and let's make sure that we're protecting all our community members, even those that are here as part of our immigrant community. And more importantly, if we're hearing anything that is harmful for our community members that are dividing and creating hateful rhetoric, let's please stand up and ensure that we're pushing back and we're not standing for that hate rhetoric that is being put forward. Thank you so much.
Thank you. Thank you, Council President Gomez. Next, I want to bring up my member of the State Assembly. She also is a family unit, the only person here I don't have to maintain social distancing from, Assemblywoman Lorena Gonzalez.
From the state's perspective, it's really important right now that we're getting accurate information out to our immigrant communities. I'm proud of my immigrant community, representing most south of here all the way to the border, but we know there's a lot of fear right now. And there's a lot of fear because there's a lot of misinformation being communicated to our families, and we want to make sure a couple things are well understood. Your immigration status will not affect whether or not you can get tested for the virus or whether or not somebody will be waiting for you. You can go get tested despite any immigration status issues you're facing. You should get tested if you're sick. The reality is, so many of our immigrants are serving us still. They're still in the kitchens of our restaurants. They're still in the halls of power, cleaning up after us, and we need to make sure that they're safe too. If you are not documented, you can still get food from the food bank. They will not ask your documentation status. Your children can still pick up free lunch and free breakfast from their schools. They will not ask your documentation status. That's really important. So there are food resources available. For those people who have contacted our office and who have questions, who are legal residents but are worried about the public charge issue with President Trump, there is this fear that if they access things that they actually have paid into, that they will be forbidden from being able to become a citizen in the future because of that public charge issue. This is what we know for sure. You can access unemployment insurance without putting in jeopardy your future naturalization. It's very important that you do that. That is a benefit that has been paid into by your employer for you. You can also access paid family leave and temporary disability if somebody in your family is sick or you are sick. You can also access workers' compensation. All of these programs have been prepaid in. You are not a public charge as a result of that. You can, of course, go get testing at a hospital, and you can even get emergency medical care and emergency Medi-Cal without putting into jeopardy your future citizenship status. These are really important benefits that you deserve and should be accessing. And of course, you can use food banks, free lunch for your kids if they need it, free breakfast, and your immigration status will not be affected. It's important we get that information out. And if anyone has any questions, whether they live in the Assembly District that I represent or not, they can call our office, especially about state programs like unemployment insurance, paid family leave, state disability insurance. They can reach us at 619-338-8090. We are working and we will continue to help you process those claims. Thank you.
I want to thank our elected officials who are here. Before we go and hear from a few of our advocates, I want to reiterate our public health advisories and guidance. If you have flu-like symptoms, if you have a fever, if you have a cough, if you have a sore throat, we are asking you to assume that you are a positive and to isolate yourself at home and to isolate yourself from anyone else. If you need to go to the hospital because you are in that level of distress, then we encourage you to seek out medical care and attention. We do not have the testing capacity to test every single individual who has symptoms. We do not have the testing capacity at this time to test every individual who would like to have a test. We are working tirelessly every day to increase our testing capacity, but it really is important that folks adhere to the social distancing. No mass gatherings of 10 or more, even under 10 outside of a family unit. We are asking you to maintain that social distancing along with all of the things we can do to prevent the spread of this. Staying home if you feel ill, staying in isolation if you feel ill, but please do not go to the hospital or the doctor unless you are really sick. If you wouldn't normally go to the doctor with the symptoms you have, then we encourage you to isolate at home. If you're in a situation where that is not an option to you, you do not have the ability to isolate at home, then please contact us and we will try and help facilitate your entry into a proper thing. But we really want everyone to know that if you rise to that level of needing medical attention and care, regardless of your immigration status, it will be available to you. Next, we want to hear from a couple of our advocates. First up, the Executive Director of the ACLU of San Diego and Imperial County, someone we have worked with for many, many years on issues of importance to the immigrant community. Please welcome Norma Chavez-Peterson.
Good morning, everybody, and thank you for having me here. Again, my name is Norma Chavez-Peterson. I'm the Executive Director of the ACLU. And I'll just reiterate a little bit what already has been said, but I think it's really important to echo that if there's anything that this pandemic is teaching us is not only, it's that the only way to reduce the harm is to think and act as one community. And I think many of us have witnessed kind of the different messaging coming from the federal administration versus our state leadership and our local leadership. It means that keeping everyone fully informed with the latest public health directives and ensuring equitable access to medical services. Again, we're hearing different messages that are coming from different sides of our government. I'm really thankful to live in California. Our response to this pandemic will be more effective and more lives will be protected if everyone in our communities is screened, tested as soon as possible. As this virus continues to spread, we're mindful that injustice and xenophobia can spread just as quickly and dangerously. We know that the most marginalized people are often the most impacted. Thus far, we've seen troubling signs, like I said, from our federal government that, immigrants are not fully embraced in efforts to keep our community safe, our collective selves safe from this pandemic. We've seen immigration enforcement agencies continue to raid homes, to arrest undocumented people, and we have to counter that fear. We're working hard across the country to make sure that the federal government actually does what's right and stops interior enforcement to make sure that they're not fueling that fear. But again, we can control what we can control. And what we control is California and San Diego and our communities, and making sure that we are countering that division, that fear, and that hate, and that we recognize that we're intrinsically linked together, and that our ability to be healthy and to be safe is dependent on each other, including our immigrant communities. We've all known that immigrant communities are some of the most resilient. And so I wanted to stress to immigrant communities, I'm going to say it in Spanish in a little bit, and I know Lorena already mentioned the benefits, but there is a lot of fear. I will say that, just yesterday I spoke to a documented young person in our community who was so afraid that was going to disenroll from WIC because of fear. So we know that the fear is real, and the way to combat that is to make sure that our community knows that they have a right to access, of course, medical care. Call your community clinics, call the county public health department. You have a right to health care. You have a right to access the food that's available. Your children have a right to education. We have a right to access these services, and we should not be afraid. It is up to all of us to make sure that our immigrant neighbors and families know that they should not be afraid, that they can access these services, that they reach out to their elected officials if they have questions or struggles accessing them, and that they reach out to community organizations. I do want to say that our job at the ACLU is to make sure that we're protecting everyone's rights, and we are also working around the clock. And so I want a message to our community that if anybody feels like they've been their rights have been violated, they weren't given medical care, they were not treated adequately, they were told that they couldn't, even though they could have access to health care, I want them to call our office. Our phone number is 619-232-2121. You are not alone. We are in this together, and we will get through it together. I'll do it in Spanish really quickly. Buenos días a todos. Mi nombre es Norma Chávez. Nada más para recordar a nuestra comunidad migrante. Obviamente sabemos que el virus no discrimina. Sabemos que es una pandemia seria, y el mensaje más importante es que no podemos vivir en miedo. Tenemos que asegurar y saber y informar a nuestras propias familias, a nuestras propias comunidades, de que sí tenemos derecho, el derecho a acceder a servicios médicos, comida para nuestros niños en las escuelas, la educación, para que nuestros hijos en la casa tengan esos recursos educativos. Tenemos derecho como comunidades migrantes a tener acceso a esos derechos, y por alguna razón hay alguna violación de derechos o sienten como que les negaron algún servicio, quiero que nos llamen a nosotros, al ACLU en San Diego, al teléfono 619-232-2121. Muchas gracias.
Thank you, Norma. Next, we're going to hear from Ramla Sahid, the Executive Director of PANA. Ramla?
Thank you, Supervisor Fletcher. My name is Ramla Sahid. I'm the Executive Director of PANA, the Partnership for the Advancement of New Americans. Our work at PANA is focused on ensuring our families who have fled violence and persecution are on a path to meaningfully rebuild a sense of home in this country and achieve economic and social belonging. Our refugee families know from experience that we pull through by pulling together. And this is a moment to pull together for all San Diego families. This crisis has shown us that we are dependent on each other, and whether we're Black, white, Latino, Asian, Native, or newcomer, we know it's time to pull together to demand the testing, treatment, and time off we all need to get and stay well. Only by standing united can we ensure our own well-being through this outbreak and rewrite the rules to ensure better health for all of us for generations to come. We have seen quick and strong leadership from our state, from our county, from our city, from local philanthropy and our nonprofit sectors. We have seen the support to provide immediate needs and ensure that families who are struggling with basic needs and resources have access. So we encourage you to call us for our refugee families who are Arab, Middle Eastern, South Asian, African continent, from the African continent, Middle Eastern. We encourage you to call PANA, the Partnership for the Advancement of New Americans. We've shifted our workloads to ensure that families have access to immediate supports. And we also know that our local nonprofits throughout the county are providing emergency support around eviction support. If you get an eviction notice, please call someone immediately to get support with that. We've got an emergency fund at the county level. Various nonprofits, including PANA, are creating funds to support our refugee families and ensure that you are able to have access to healthy foods, to internet access, and other basic services. So for all of our families, I think this is a moment that we don't panic, that we pull together as community to support one another and look out for each other, especially those who are vulnerable, our elders and young people, folks with who are maybe undocumented and are unsure about how their immigration status may be affected by accessing services. For our families who don't know when to seek help, again, I want to reiterate our county supervisor's message around if it's something that you would have normally not gone to see the doctor for, stay at home, stay isolated, and ensure and keep everyone, including your loved ones, your family, safe. Thank you so much.
Thank you, Ramla. Our final speaker is Leanne Kim. She is the founder of the Pacific Arts Movement, and we're pleased to have her here today. Leanne.
As a first-generation immigrant, when I hear about this talk about the Chinese virus, I just roll my eyes and think, that is so old. And I am reminded that these kinds of tropes have been baked into American culture and history associating immigrants with fear. And history has shown that when we're afraid, we want someone to blame, and we often turn to xenophobia, and we know that doesn't really solve anything and only creates more problems. Asian Americans are actually the first illegal immigrants in the US during the Yellow Peril era. The Chinese in particular were seen as dirty, diseased, taking away jobs from good people. That, of course, led to the Chinese Exclusion Act. Fast forward today, where even before all these social distancing measures, Asian restaurants have been the first to financially suffer, and they became ghost towns. And there are increased reports of bullying, harassment, and violent hate crimes against Asian Americans. And in one case that was reported on CNN, a woman was attacked on the subway by a man who yelled, "Every disease comes from China. Everything comes from China because they're disgusting." And by the way, this victim was Thai American. So when we hear xenophobic rhetoric, especially from Washington, we cannot ignore it. We must condemn it right away, call it out, and force our leaders to be accountable because our well-being is at stake. And can I gently remind everyone that Asian Americans are American? So let's be clear about the science. COVID-19 has nothing to do with race. It has everything to do with travel patterns and contact history. And at this very moment, thousands of Asian Americans are part of this country's efforts to contain COVID-19 at great risk to their own personal safety. Whether it's the medical doctors or nurses on the front lines, whether it's the researchers working around the clock to find a cure, teachers who are rebuilding curriculum, delivery folks, or the cleaning and disinfection squads, we are all doing our part. And finally, may I add on a personal note, as a parent of children both in middle school and high school, in our society, many people might scoff and laugh at those words, Chinese virus or the Kung flu. But guess who's going to pick up these first? Our kids. And they can be so brutal when it comes to bullying online and spreading racist remarks without even being conscious of it. So I personally ask for all you parents out there, we have the time now to have the conversation with our children about this, because none of us want our children to be bullied, and of course none of us want our children to be the bully. So if you agree that we're all human and we're all brothers and sisters, let us choose compassion over fear. Thank you.
Thank you so much, Leanne. You know, your words remind us that the motto of our country, e pluribus unum, out of many is one. And the simple reality is that on a day-to-day basis, we are one community. And regardless of what may happen at the national level or in other jurisdictions, here in San Diego, we're better than that. Our diversity in San Diego is what makes us strong. It's what makes us united. And it's incumbent upon, just like each one of us has the ability to take action to slow the spread of coronavirus, each one of us has the ability to slow the spread of racism and xenophobia and the nonsense that we're seeing associated with this device. And although unlike other disasters where we literally come together and lean on one another and stand united, in this one it's not proximity, but it is purpose. It is purpose in slowing the spread. It is purpose in letting our neighbors and our friends know that they are loved, that they are welcomed, regardless of their immigration status, regardless of their country of origin, regardless of their ethnicity, their race, their gender, their sexual orientation. Coronavirus doesn't detect any of those. They don't discriminate. Coronavirus does not discriminate against any of those, and neither will we here in San Diego. So we thank all of our speakers for being here today, and we just want to remind all of our communities out there the help that is available to everyone. And as you need it, we want you to know that you can access it. At this point, we'd be happy to take a few questions if there are any. If not, I think the folks that are here are available for one-on-ones.
We want to know, with everybody, out of jobs, will you help suspend AB5?
You know, I think AB5, the reasoning behind AB5 is so that every worker, despite their field, has access to unemployment insurance, health care, paid sick days, the access to paid family leave, temporary disability, and workers' comp. There is no time that those benefits have become more important than right now. The last thing we should do when we see 80,000 people having to apply for unemployment insurance is to take that away from people who just got their employment status, or away from workers who are currently misclassified under AB5 who can still file for unemployment insurance and get some sort of relief. I think it is ludicrous to make this into a political issue when it's clear as day, that what we were trying to do was right. Workers, all workers, deserve the right to paid time off if they're sick, to minimum wage and overtime, to unemployment insurance when suddenly out of nowhere their job goes away. What we're trying to do today is not repeal AB5. It's to ensure that all of those workers who, and there are a lot of them, who aren't protected by workplace protections also have relief. Those workers are also feeling the effect of this downturn, sudden downturn in the economy. And there is no program that helps them. We need to make sure we're helping everybody right now, but we need to rethink how we look at employment and how we ensure that everybody in these times has had an employer put into these funds so that they can access them when they need it the most.
Thank you. With that, I know folks are available for one-on-one interviews, and we appreciate everyone for being here. Thank you.